Our first presenter is Shawna Himsl, and Shawna did her practicum at the University of Montana Center for Children, Family, and Workforce Development, and her site mentor was Mackenzie Peterson. Thanks, Mackenzie, for joining us today. Mackenzie is the director of the community-based public health projects over there. And the name of Shawna's presentation is Development of Learning Modules for the Center for Children, Family, Workforce Development Crisis Certification Program. So, all right, take it away, Shawna.
Thanks, Lee. Good afternoon, everyone. As Lee mentioned, I'm Shawna Himsl, and thanks for attending my presentation on my applied practice experience, which, as you can see, has a bit of an unwieldy title. But let's see if I can. Oh no, it's not advancing. Nightmare. Okay, so to provide some context for this project, my site, the CCFWD, is dedicated to improving the mental, physical, and emotional health of Montanans through workforce development and training. And recently, they've been working to establish a crisis certification training program for both licensed and paraprofessional practitioners. And I had the honor of developing 2 draft learning modules for the program that focus on responding to domestic violence and substance use crises. My site mentor, who led me to this project, the wonderful Mackenzie Peterson, she works at the center as a director of community-based public health projects, and I am so grateful to Mackenzie for her guidance and support on this project over the past year. So as I mentioned, I developed 2 learning modules. The first focuses on addressing domestic violence crises. So this module includes 4 key learning objectives, which are understanding the scope and impact of DV and the effects it has on both individuals and communities, recognizing the signs of DV, and not just the obvious like physical signs, but also the more subtle ones like emotional and financial abuse, how to communicate effectively with DV survivors using empathy, sensitivity, and a non-judgmental approach, and how to implement intervention strategies like safety planning to support survivors and connect them to resources. Additionally, the module was developed around themes of self-awareness and reflection so that learners examine their own biases and how these might influence their approach to supporting survivors. Cultural competence, so that learners understand and respect the cultural backgrounds of survivors to offer the most relevant and sensitive support. Of course, empathy and validation, which are both key to building trust. The modules stress the importance of making survivors feel heard and respected, and then empowerment and support, so that learners focus on providing non-judgmental assistance and resource connection to help survivors regain control of their lives. So to connect learning to practice, I designed several activities and tools for the module that included a biases and assumptions self-assessment to help learners reflect on how their personal beliefs might shape their communication with survivors. I included dozens of sample questions and prompts in the effective communication strategies section to guide learners in having empathetic, validating conversations. There's a role play activity where learners can practice responding to real life DV scenarios to sharpen their communication skills. And there's also a safety planning activity to help learners develop personalized safety plans tailored to the specific needs of survivors. So the second module that I developed focuses on substance use crises, a topic that's really close to my heart, as this is the population that I've worked with for the past 7 years. And to make sure that I did this topic justice, I developed 5 learning objectives for this module that include understanding the scope and impact of substance use and how it affects individuals and their families and communities, recognizing the signs of substance use crises to identify when intervention is needed, effectively responding to all types of overdoses, including the use of naloxone, understanding and stabilizing individuals going through withdrawal, and then harm reduction strategies that minimize risk and promote safety in crisis situations. And like the DV module, this one was built on several key themes, including situational and self-awareness. So as we know, there's a lot of stigma around substance use. So the module asks learners to consider their personal biases. Cultural competence, just as in the domestic violence module, respecting and understanding diverse backgrounds is crucial for providing relevant and sensitive support. And then empathy and validation and empowerment and support. So the module is ultimately designed to not only empower learners with the confidence to provide compassionate and effective support, but also empower individuals experiencing substance use crises. A few key highlights from this module that I believe enhances its relevance and impact include recognizing the signs of overdose activity, which uses real-life scenarios to help learners practice identifying signs of substance use crises. There are several reflection questions throughout the module that encourage learners to examine their own experiences and biases, helping to build self-awareness and empathy. And then finally, the section on harm reduction and crisis prevention educates learners on services like syringe exchange programs and naloxone distribution, and describes how these strategies reduce risks and improve community safety. So as is required in an AP, the competencies I selected for this project emphasize the importance of effective communication and the skills needed to promote public health information to diverse sectors and audiences. Equally important, though, was my focus on cultural competency and ensuring that the information that I provided was not only culturally informed, but also relevant and relatable. For me, prioritizing cultural competence in my products was really paramount. And I'm pretty proud to say that I feel that I successfully achieved that goal. So as an MPH and an MPA student, one competency that I especially wanted to zero in on is how crisis intervention provided by licensed and paraprofessionals can intersect with policy analysis. Because to be honest, at first I struggled to make clear connections between the two. So firstly, this project really reinforced for me that both licensed and paraprofessionals are key in crisis intervention, but paraprofessionals in particular, I feel that they have a unique advantage in that their direct interactions with clients and community members enable them to spot gaps and barriers to services. And this kind of insight is crucial for policy analysis to ensure that community needs are properly reflected and prioritized. Additionally, the data and experiences gathered by particularly paraprofessionals can be utilized to guide mental health and substance use policy that is relevant and, most importantly, informed by the lived experiences of individuals in crisis. And lastly, training these professionals is particularly crucial for Montana, not only due to challenges like provider shortages and morality, but also because the state continues to struggle with past policy decisions like the loss of mental health case management in 2017. So training professionals who are already embedded in their communities, I feel can help address these ongoing service gaps. And it's my sincerest hope that as the CCFWD, their crisis training program expands, it will strengthen the crisis support infrastructure across Montana, benefiting individuals in crisis and potentially influencing future policy decisions around mental health and support services. So to highlight some challenges and successes I experienced while working on this project, I will admit that it took a bit of adjustment for me to design learning content for professional adult learners. In the past, I've designed and delivered learning content to adolescents, but having to ensure that my content was concise and engaging for individuals that don't really have a lot of time was a bit challenging. But thankfully, my site really provided me with some helpful tips to guide me along in that. And while creating the module on domestic violence, I realized as I was working through it that I have some antiquated biases around this topic, which made me feel a bit uncomfortable with myself. And I realized that when I was in a previous role and screened individuals for intimate partner violence, when I reflect back on it, I don't think I took it as seriously as I should have, which makes me feel a bit ashamed. So when I was working through the module, I really tried to design it in a way that would have helped me understand the appropriate way to approach this topic. And then finally, my biggest takeaway during this project was that I do have the skills to design meaningful, culturally competent, and effective content. At the start, I had a bit of imposter syndrome and thought that I was just going to churn out some really boring kind of drivel, but I'm pretty proud of these modules. And I think that even I would be more enthusiastic about continuing education opportunities if all modules were designed in the way that I created these two. So that's me, and thanks so much for listening, and special shout out to Lee and Mackenzie for helping me along in my project.
Thanks, Shawna. Awesome. Yes, wonderful. And thank you again to Mackenzie and everybody over at the center for helping Mackenzie or helping Shawna with this project. So our next presenter, and I do want to just make a comment about if you have questions for Shawna or Joya, you can go ahead and write them in the chat. And I will be reading those off at the end of both presentations, or just hold your question to the end and then you can unmute yourself. So, so our next presenter is Joya. And Joya Lucky, and Joya did her practicum with Missoula Public Health, and her site mentor was B. Rad Applegate, and who is also in our program, I believe. And the name of Joya's presentation is Addressing Lead Exposure Health Impacts, Reporting Protocols, and Key Considerations. So if you want to share your screen, Joya, and take it away, that'd be great.
Yeah, are you guys watching my screen now?
Yep, it looks good.
Okay. Okay, so yeah, I'm ready. Why it's now? Okay, so good afternoon, everyone, and thank you for coming here and joining with us. My name is, as already Lee mentioned, Joya, and my middle name is like Dev, which is why I'm always like hiding it. But so yeah, you can call me Joya, like you both of this the same. And I'm excited here to present my AP presentation, and my presentation is actually focusing on public health challenges associated with addressing lead exposure, and with a particular focus on Montana's context. My site mentor was B. Red Applegate, and Taggart Lee was my course instructor. So, and I present my presentation to primary healthcare provider of Partnership Healthcare Center, who are actually like collaborated with Missoula Public Health. So let's start my presentation. So my today's presentation's agenda is like overviewing my issues and including some background and rationale behind this project. And next, I'll try to discuss the objectives and goals that I aimed to achieve, and followed by project scope and expected outcomes. I'll also highlight the key strengths of my presentation and the challenges I faced during creating this slide. And lastly, I also try to share the updates and about the timeline and future actions. So here is my overview. So the lead exposure, I think all of you might know about this public health issue. So this lead exposure actually remains a critical public health concern, which is disproportionately affecting vulnerable groups of people, such as children who are under age of 6, then pregnant women, and some refugee populations as well. And lead is pervasive in our environment, found in soil, water, air, and particularly in older homes, many of which were actually built before 1978. In Montana, this issue is actually exaggerated by the prevalence of older housing and low child lead screening rates, because from a data we have found that only 13% of children are getting tested, where needed actually like kind of 45% of children should be tested at least for once or twice in a whole year. So this is kind of a leading question for me to address this lead exposure. Then my project scope was to identify 3 aims: that identify lead exposure sources, understanding its health risk associated with varying different platelet levels, and also establishing protocols for testing, reporting, and management to mitigate the risks. I believe by tackling these aims, we hope to improve the lead prevention and management strategies across the Montana state. And I also expect that by increasing awareness among especially the healthcare providers, which was my goal in this presentation, and also improving reporting practices, protocols for better tracking and intervention, and protect at high risk populations through proactive and preventive strategies, we can achieve our goal. So I have divided my goals in 3 distinguished ways. So first of all, I actually like to equip the providers, like primary healthcare providers, to understand or identify the lead exposure sources and how this lead exposure actually getting affected in our health, and as well as its risk factors. And also I wanted to clarify the reporting protocols and treatment strategies. And lastly, I also try to address some prevention strategies, particularly for vulnerable populations like refugees and children who are under age of 6 years of age. So my timeline for this presentation has actually started from August, like the beginning of this semester. And throughout the August, I have tried to gather all kind of information. And then the September, I just engaged myself to develop the presentation of the first draft of my presentation, as well as some infographics. And I have tried to practice presentation, and in November, on October 8, I delivered my presentation to the primary healthcare providers of Partnership Healthcare Center. So here is some like my deliverables of this presentation when I was delivering my presentation. And here are some key presenting slides of mine, that where I actually try to introduce the health effects of blood lead level, and how we can establish a testing schedule for the vulnerable populations or the key populations for this awareness program. And I have also tried to make some infographics, especially for primary healthcare providers who can actually assess themselves, their knowledge, and also can share some preventive measures to their patients by sharing some leaflets, which I actually try to make some. So this is the end of my presentation at that day. When they are all actually like registered nurses of Partnership Healthcare Centers, and at Zoom they have also some registered doctors who are also like acknowledged me during this presentation. So for this whole presentation, my target population or target audience were kind of diverse, because I chose primary healthcare providers because and also as public health officials who are actually like to help to improve the surveillance, reporting, and the response systems of the lead exposure. And I also mentioned the vulnerable populations here because in Montana, these vulnerable populations are tried to like neglected by in terms of testing blood lead level. So I have also tried to highlight this point. And lastly, I also included community organizations, because without their support, we can't achieve or educate our local level community. So these are my these are my target audience. And to talking about my strength of this presentation, I try to make it organized for the healthcare providers so that they can easily apply the testing schedules or follow up these things. And also I try to include, as I mentioned before, the vulnerable populations, which I think it is actually a great finding for my presentation. And also I have tried to simplify the protocols of blood lead level testing so that they can just gather the identification that who are the suspect cases of blood, suspect cases for lead exposure and who are not. Some challenges I have faced here, like synthesizing the data from different kind of sources, like from CDC, then Montana State's uh, data sources. These are my one of the challenges, but the biggest challenge was coordinating schedules to present the diverse audience, like registered nurse, then doctors, and trying to find their convenient schedule with them. That was a big challenge for me. And actually at that moment, my site mentor Beard actually helped me a lot to just fix this meeting with them and try to just describe my situation or something like that. And also I found some difficulties during making the presentation, some technical difficulties, which I also want to highlight there. So yeah, that was my challenges. And there are my resources, which I actually used to present my slides. So these resources I have compiled here so that you can just go off these resources which are included with CDC guidelines, state-specific protocols, educational materials. So anyone can go through and just get that updated knowledge or resources. So yeah, thank you. Here is my presentation. Feel free to reach out to me and I'm ready to answer any of the questions from audience. Thank you.
Thanks, Joya. Great job. Yes, and I think that comment about some of the challenges and the technical difficulties we can all relate to. So we do have a question in the chat from Heather for Joya, and she asks, would it be possible to get a copy of Joya's lead handouts? So I'll let you answer that, Joya. I don't want to answer for you.
Yeah, sure. I have made some copies. So should I drop here or I can email anyone?
It's up to you if you want to, if they're ready to go, or you can we can connect the two of you and you can send them to her that way to
yeah,
Heather.
Okay.
Yeah, or maybe Heather, if you want to put your email address in the chat, then we can ensure that Joya has your email, and maybe anybody else that's interested in those handouts. And B Rad says, thanks, Joya, awesome work. So, and I also want to just put out a big thank you for, go ahead.
Joya, you did an awesome job. Thank you. And you did a project that we've tried to get some students to do for a number of semesters. It was a challenging project and we needed you to see it through. We call ourselves Team Awesome for a reason. It's a tall order, a lot to live up to, and you were awesome to work with. Thank you very much.
Thank you. Thank you, actually, including me here.
That's great. We love to hear those. Thanks, B-Rad. Does anybody else have any questions out there? I can see Carrie's got the celebration emojis going. Yes, very exciting. Any other questions? Sarah Black says, great job, Joya.
Yeah, I actually want to highlight this. All of people from Team Awesome are here present. So I'm actually feeling very honored right now. So thank you. Thank you, Team Awesome, just joining here.
That's great. Yes, and again, we can't do these projects without the sites, the site mentors.
Exactly.
And we are so grateful. And yeah, thanks to everybody who has been a site mentor. And yeah, we can't do it without you guys. So unless anybody else has questions, this was a short set of presentations this week. It was a good week to get the technical issues over with. So because next week we're going to be joined at this same time with 4 students presenting their practicums. And there'll be an announcement going out about that probably tomorrow. And so please sign up, and same place, same time. And again, thank you to everybody that showed up today. Thanks for bearing with us. And then thank you to Joya and Shawna for great job on your presentations. And thanks, Carrie. And we will see everybody next week at this same time. Congratulations, Joya and Shawna.
Thank you.
Thanks, you
everyone.
guys.
Thank you. Yeah, and I'm going to send my infographics to you.
Sounds
Yeah.
great.
Yeah. Thank you.
Sounds
Thank you,
great.
everyone.